For many years, doctor believes that pain is just a warning signal from injured tissue. And pain travels from injured tissue to our spinal cord to our brain, and it disappears once the healing is done. But some people experience the pain for months and years even after they are healed. And neuroscience explains this with the help of neuroplasticity. Neuroplasticity helps us learn new skill and recovers our body. But still, it became a maladaptive. Means the nervous system itself leaves the pain instead of healing it. There are three types of pain. First one is the nociceptive pain, caused by the actual tissue injury. The second one is the neuropathic pain, caused by the damage of nerve cells because of the electric shock or burning sensation. The third one is the nociplastic pain, caused by the actual nervous system. Our brain and spinal cords become overly sensitive due to the chronic pain, and it can be the source of the chronic pain, and it itself becomes the source of the chronic pain. Our brain contains some kind of immune cells called the microglia, and this microglia releases an inflammatory chemicals due to the chronic pain, and these chemicals keeps the pain pathways active and resist the nervous system to calm down. Now let's understand how the pain is processed in our brain. The first one is the somatosensory cortex, where the pain is actually located. The second one is the amygdala, where the pain gives us fear and emotional reactions. The third one is the prefrontal cortex. It changes and makes the decision because of the pain. And the fourth one is the anterior cingulated cortex. It gives us emotional reaction because of the pain. And this region became more active because of the chronic pain and then the area which detects the pain. Our brain doesn't passively receive the pain signals. It actually regulates on the top-down modulation. Our brain signals the spinal cords to whether amplify or amplify the pain signals. Now, the positive and negative emotion also majorly influence this top-down modulation. Now let's understand how we can reduce this chronic pain. The first one is the sleep. A sleep is a biological healing. Our brain needs the lymphatic system to clear out the metabolic waste and debris surrounding the damaged nerve cells. And the lymphatic system operates under the deep sleep. And without the deep sleep, we cannot reduce the chronic pain. The second one is the gut health. A poor diet majorly injects the byproducts of the bacteria into the bloodstream, and then this travels to the brain, causes the microglial activation, the brain inflammation, which can actively does not reduce the chronic pain. PRT, pain reprocessing theory. Pain reprocessing theory is an idea based on if the patient sees the pain through the lens of safety and curiosity instead of fear, the chronic pain can be reduced. And the fourth one is the physical modulation. Even a low-grade exercise can release the natural opioids and cannabinoids in our brain, which can eventually reduce the chronic pain. A pain is an incredibly complex experience by our body and brain. While the acute pain is necessary for healing, and chronic pain is an disease of neuroplasticity. And with the help of neuroplasticity, we can actively reduce the chronic pain and accelerate our healing, but we need to use these techniques.